Donzapil is Aricept. Yep. Cogentin.
Yeah.
Right. What's the generic name for Cogentin?
No.
Nope. Nope. All right, that's homework. Homework is give me the generic name for Cogentin.
What does that with?
Starts with a B.
A B?
Yep. Yep.
Somebody said it.
It's just like riding a bike when you go back, right?
I know.
Okay, so gout medication. What is the most important intervention we want to teach the patient who is taking gout medication?
Just like food that's gluten-free.
That's true. What else?
No alcohol, no.
What else?
A low-protein diet.
Increase fluids, right? Think about those uric crystals. We have to flush, right? Give me an example of a gout medication. Colchicine, okay. Allopurinol, okay. Benamid is another one. What is the drug of choice for irritable bowel syndrome? Drug of choice. Nope, that's for bladder. It's called Bentyl, Bentyl. Bentyl. Hi, Fallon.
Hi.
All the way from Baltimore. Bentyl, yep, Bentyl. What drug should you not take or should you avoid if you have an allergy to sulfa drugs and this drug treats glaucoma? This drug treats glaucoma.
What's the first letter?
D. Diamox. Diamox. It treats glaucoma. And you don't want to take it if you have an allergy to sulfa drugs. Dilantin level. What's normal dilantin level? Dilantin, not digoxin.
Oh, 10 to 20.
10 to 20. Give me another 10 to 20 drug. Theophylline. Theophylline, yep. The treatment of hypotension is what? What is the treatment of hypotension?
You give them just the medication or
Medication wise, talking about farm.
I get rid of it.
It's when the blood pressure is extremely low and the patient is at risk for shock. What are we gonna give them? We're gonna give them dopamine, right?
Yeah, dopamine.
Dopamine. Dopamine is also used for what? What do we use dopamine for? Parkinson's.
Yeah, Parkinson's.
Yep. We use dopamine for Parkinson's as well. What did I tell you about major risks and emergencies when it comes to patients that have a change in vital signs? Which one is more detrimental? High or low? Low, right? So hypotension, bradypnea, bradycardia, hypoglycemic, the hardest to treat, right? Those are indicative of major risks and emergencies. Thinking about your triaging, okay? All right. What age do we test children for lead poisoning?
5. Preschool.
12 months.
Oh, 12 months. Okay.
Yep, 12 months. We test children for lead poisoning around the age of 12 months. Cor Pulmonale. What is Cor Pulmonale?
That's something to do with the heart.
It has something to do with the heart. That is correct.
It's
Say it again. Cor Pulmonale.
I'm reading this.
You reading it?
Right-sided heart failure caused by life in that particular field.
Yes. Yes, that is right. Right-sided heart failure caused by left ventricular failure. So when you have complications on the right side, you're going to have what type of problems? Edema. You're going to have systemic problems. When you have complications on the left side, you're going to have what? Pulmonary. Okay, so now you know what signs to look for when it's right-sided heart failure, right? Right versus left. What do we use for acute pain? Cold or hot? Cold. If you hit your head, the first thing you're going to do is what? Get some ice, right? We use cold for acute pain. We use heat for chronic pain, like rheumatoid arthritis. Let's talk about the stages of labor. Let's go into L&D a little bit. In which phase is the mother going to dilate 5 to 7 centimeters? What phase of labor is that? Phase of labor. There's 3 phases in stage 1, right? That's the only stage with phases, right? So which phase of labor is the patient going to dilate 5 to 7? That's the second, right? The second phase of labor is also called what? Is it latent, active, or transitioning? Active. That's active labor, right? Active labor is 5 to 7 centimeters. How far apart are those contractions? How many minutes? 3 to 5. 3 to 5. Yep. 3 to 5 minutes apart, lasting how long? How many seconds? 30 to 60. 30 to 60 seconds. Yep. Remember, as it goes into the transitioning phase, they last longer. Okay, so when you get to the transitioning phase, which is phase 3, you're going to be about 60 to 90 seconds in a contraction. The frequency are going to be less. So the frequency will be less, but the duration will be longer. The frequency will be 2 to 3 minutes. They'll be coming back to back, right? But lasting a long time. And in phase 3, you're dilating to what? 8 to 10, right? 8 to 10 centimeters. Strong, hard contractions, right? What type of feedback system is this? Now, I'm doing a little throwback here. This is like A&P. What type of feedback system is that? Is labor? Anybody? Renee, you know? What type of feedback system? That's a positive. It's a positive feedback, right? Positive feedback is not something that's really favorable on us, but we have to do it because we have to produce an outcome. So that's a positive feedback. A negative feedback would be what? You get too hot, you start to sweat, right? You see the difference in that? If I get too hot, I'm going to cool off. When I'm in labor, the pain is going to come, but it's going to get stronger and stronger, and the body is going to allow it to do that for that moment because I want to produce an outcome. So that's why positive feedback is usually short term. That makes sense? Stage 2 of labor is delivery of the what? The baby. Delivery of the baby. Baby comes out, right? What do? What's the first thing you're going to do when the baby comes out? Suction. What do we suction? What do we suction first? Mouth. Mouth, then nose, right?
Where's the top?
Then we're going to check the neck. What are we checking the neck for? What do you check the neck for?
Well, like they have like those little nodules.
Check to see if the cord is around it.
Okay.
Yeah. You check to see if the cord is around the neck. Okay. Then you're going to have delivery of the shoulders and the body. And of course, safety first. Put the ID band on the baby. Stage 3 is delivery of the placenta. What do you check the placenta for? Ava. 2 arteries, 1 vein, right? Check the cord. Make sure it's all there. You're right, LaShawn. Make sure it's all there. Make sure you have all the parts of the placenta. Do not leave the placenta in the mom. Please. Stage 4 is what? Recovery. What is important about recovery? Bleeding. Right. Bleeding. In the 4th stage of labor, think about it like this. You're going to do 4 things 4 times. What are you going to do? Vital signs. Every 15 minutes, right? Fundus check. Every 15 minutes. Checking pads. Enrolling mom. Okay? 4 things 4 times. In an hour. When you check in vital signs, what are we looking for? We're looking for signs of what? Shock. Shock. Hemorrhaging, right? Yep. Fundus check. If it's boggy, what do? Massage it. If it's displaced, what do? Tell them to go pee, right? Pee or catheterize them, right? Why are we rolling mom over? Check for bleeding underneath her, right? The biggest thing with these things is you want to pay attention to the question. Phases are not stages, okay? That's where a lot of people go wrong. Complications. Painful back labor. Painful black labor. This is a low priority. Okay? So you just want to put them in the knee chest. That kind of relieves that pain. It's a low priority. A high priority would be a prolapsed cord. When it comes to monitoring fetal heart rate, variability is indicative of what? If you see variabilities on the monitor. Cord. That's cord compression, right? Early decelerations are what? Early decels. What are early decels? Head. That's head compression. What about accelerations? Accelerations are okay. That's expected, right? That's fine. And late decels indicates what? Placental insufficiency.